joining us today. I'm wondering, could you tell us who you are and your specialty in medicine?
I am Dr. Pharoan, specializing in gastrointestinal surgery, critical care medicine, and nutrition support.
Tell me, how long have you been in practice?
Well, I have been in practice for 32 years.
And tell us, where did you study?
I studied in Damascus, Syria, at the University of Damascus Medical School. Then I came here to Baltimore, Maryland for specialization in surgery.
And could you tell us a little bit about the mission you have for your practice?
My mission is to take care of patients, take care of their family the way I want to be cared for.
And could you talk something about your goals within your mission?
My goal is to take care of patients with the least bit of complications, least bit of pain, and make as much as it can be that their experience in the hospital as least painful as it can be.
And speaking of taking care of patients, what type of surgery do you do? What specialty do you have?
I'm specializing in gastrointestinal surgery, and I use basically laser surgery or surgery with small incisions to take care of stomach problems, colon problem, gallbladder, hernias.
I see. That's really interesting. And do some of these patients go to critical care after surgery?
They can. If there is any illness that requires critical care management, then I will be managing the patient also after the surgery.
And do some of these patients require special nutrition?
Yes, if the patient cannot eat or drink, then they have to receive intravenous nutrition. And I use that by inserting certain catheters specialized in that kind of nutrition.
And could you tell us a little bit about your family, what you do when you're not doing surgery?
Well, I came from a family of doctors, lawyers, pharmacists, and engineers. I am really taking the steps of my grandfather, who was a physician, and my older brother, who was also a physician. And I'm hoping at least some of my grandchildren would follow that steps.
Speaking of grandchildren, tell us about your children. You have children, obviously.
I have 3 young men, and they are out there in the workforce. None of them is in healthcare, unfortunately, but they have to choose their route.
And if someone wants to contact you for your medical care, how would they go about doing it?
Yes, my 2 offices are one in White Marsh and one here in GBMC, Towson, Maryland. The phone number is 410-661-9300. And if there is an emergency, I am reachable on my cell phone, which is on at all times.
Well, thank you so much for being with us today.
You're welcome. Thank you.